So pulmonary function tests are used for various reasons. We'd like to see what the patient's lung volumes are, or we'd like to see how well the lungs are functioning. Basically, how well you can breathe in and how well you can breathe out at the same time. So this test may be used for various reasons. If we suspect that your child might have asthma and might run into pulmonary problems later in the course of therapy, we may perform pulmonary function tests up front. Sometimes some chemotherapy agents that we use, specifically bleomycin, can affect the lungs as well. So sometimes we perform pulmonary function tests before using chemotherapy agents that might do this in order to get a baseline reading and to see if there's any effect on the lungs. Because if there is an effect, then we can either decrease the amount of the chemotherapy agent or stop it altogether, depending on how much the lungs are affected. The test is a very simple test. It essentially just requires the child just breathing into a tube.
Breathe normal. All I want you to do is to breathe normal.
Basically, your child will be given a tube and will be asked to take a deep breath and then blow out as hard as they can. We'll do this once without any medication, and then we may, depending on whether the reasons for the test, may give a medication like albuterol to try to help clear some of the bronchioles or the tubes of the lung, and to see if there's any effect after the medication is given. That's usually in the case whether we need to see how severe a patient's asthma is.
Chest x-rays simply only tell us that there's a right lung, there's a left lung, there's a heart in the center, and we can see the vessels. And that's what radiologists look at. They look at what I always refer to as parts and pieces. What lung functions look at is how the lungs behave, and the spirometry looks at how stretchy they are. The pulmonary function test for a patient is a non-invasive, meaning nothing poking you. It's strictly a way for a technologist to get you to perform a respiratory maneuver or a breathing maneuver that yields us diagnostic data.